Can you get all 5 of these NCLEX style hypertension questions correct? That's the challenge I'm giving you today. Not just to test your nursing knowledge, but to teach you how to think through any kind of blood pressure question the way experienced nurses do. Memorizing symptoms and drug names is not enough when it comes to NCLEX, and it's not enough for your nursing school exams either. Not if you want to be confident walking into exam day. We'll break down each answer option with full rationales that help you understand why it's right or why it's wrong. And make sure you stick around for question number 5, because otherwise you might accidentally give your patient cyanide instead of this other common blood pressure medication. Let's see how many you can get right.
Let's read question 1 together. A client with a history of hypertension is prescribed lisinopril. Which lab value should the nurse monitor most closely to prevent complications? We'll read the answer choices. You can make your guess, and then I'll show you the answer and talk through each answer option to explain how I answer it as a professional nursing tutor and someone who knows how to think like a nurse. A, hemoglobin and hematocrit levels. B, serum potassium levels. C, blood glucose levels. D, cholesterol levels. Pause if you would like to answer. I'm about to reveal it. The correct answer is B, serum potassium levels. Let's talk through this. What do we need to know in order to answer this question? We need to know what drug class lisinopril is in. Even if you're not sure about lisinopril, the ending pril, P-R-I-L, indicates that it's probably an ACE inhibitor. ACE stands for angiotensin converting enzyme, which means this is a medication that inhibits or blocks that angiotensin converting enzyme. Now, if you've been studying with the Silver Bullet study system, which is the best way to study in nursing school, the next part should be a lot easier because your critical thinking will kick in and you'll realize that the angiotensin converting enzyme is a part of the RAS system. RAAS. That's the renin-angiotensin-aldosterone system. This is normal anatomy and physiology. And if you know what the RAS system normally does, and you know what's being changed with the ACE being inhibited, then we can easily predict any potential complications from taking this medication, even if you've never studied it before. That's the power of having studied with the Silver Bullet study system, because you get used to thinking this way. Hemoglobin and hematocrit levels, this has nothing to do with the RAS system. It has to do with blood. Serum potassium levels. Potassium is partly controlled by aldosterone, which is the last step of the RAS system. Normally, aldosterone signals the kidneys to hold on to sodium, which causes the water to follow it, making the body retain water so that your blood pressure goes up. In exchange for the kidneys keeping the sodium, the kidneys will get rid of potassium. However, when we are blocking the angiotensin converting enzyme, that means aldosterone is not going to be released. We're putting a roadblock in the RAS system. Therefore, the kidneys will continue getting rid of sodium and hang on to potassium instead. Therefore, nurses should be concerned about possible serum potassium levels because we may get in a situation where this patient has hyperkalemia since their kidneys are holding on to more potassium. Even when you think you have the right answer, it's always good to look at the others. Blood glucose levels, again, this has nothing to do with the RAS system. The RAS system controls how the kidneys hold on to water and sodium and how some of the smaller blood vessels vasoconstrict. So it's more likely to affect blood pressure. And cholesterol levels. It also has nothing to do with cholesterol levels. Now, if you did not know what drug class lisinopril was in, if you thought this was an insulin or a statin, then these would be good distractors. You do not need to study every single medication you ever come across in nursing school. Use the prototype method to cut your studying by a lot and still get most of your questions right, enough to get comfortably passing grades. Question number 2. A nurse is assessing a client who has been prescribed metoprolol for hypertension. Which assessment finding would require the nurse to hold the medication and notify the healthcare provider? Answer A, heart rate of 58 beats per minute. B, blood pressure of 142/88 milligrams of mercury. C, respiratory rate of 20 breaths per minute. Or D, temperature of 98.6 degrees Fahrenheit, 37 degrees Celsius. Pause if you want to think about it. I'm about to show the answer. The correct answer is A, heart rate of 58 beats per minute. Let's go through each answer choice so you can understand how an experienced nurse thinks. I always look at the question first. What do we need to know before we can answer this question? We need to know what drug class is metoprolol. Even if you don't recognize the drug name, the ending ends in OLOL, which is a good indication that it's probably a beta blocker. And that guess is supported by the fact that it's being given for hypertension. One of the common reasons beta blockers are given is because of hypertension. So we may assume that this medication is being given to lower their blood pressure or something along those lines. And in fact, that is what beta blockers do. Let's talk through the answer options. Heart rate of 58 beats per minute. This may not immediately seem like the correct answer unless you know what the mechanism of action of beta blockers is. And just like ACE inhibitors, it tells you in the name. It blocks the beta receptors. If you know what the beta receptors do, then you can predict everything that beta blockers do, because it's going to be the opposite of what happens when the beta receptors are activated. And the beta receptors have a lot to do with the nervous system and activating the nervous system. When the beta receptors are being blocked, it tends to calm things down, especially in the circulatory system in the heart. Therefore, knowing that the heart rate of 58 beats per minute is on the lower side, the normal range being 60 to 100, and this is beneath that normal range. We can predict that this is definitely a possible complication of a beta blocker because it's slowing down the heart, it's calming down the nervous system, but it's done it a little bit too well in this situation. If we give a beta blocker, it's going to continue slowing down the nervous system, which means that an already too low heart rate can go even lower. This is a complication we would want to hold the medication for and notify the healthcare provider. Let's go through the other answer choices just to be sure. B is a good distractor if you only memorize that beta blockers are for high blood pressure. But you're not going to do that because you want to think like a nurse and use your critical thinking skills. And we can see that this can't be the correct answer because the blood pressure is high. 120/80 is considered normal blood pressure, and this is well over that. Therefore, we want to give their next dose of metoprolol for this because we want to bring that blood pressure down with the medication. Answer C, respiratory rate of 20 breaths per minute. 20 breaths per minute is on the higher side of normal, but it's still normal. Also, there's no obvious mechanism for why the metoprolol would increase breathing rate. If you didn't know for sure, you might predict that if anything, it might decrease it since it tends to relax the nervous system, but this doesn't follow any patterns we would predict. And D, this is a normal temperature. It's easy to throw out. Question number 3. A nurse is teaching a client diagnosed with hypertension about lifestyle modifications. Which of the following client statements indicates a need for further teaching? A, I should try to at least 30 minutes most days of the week. B, I need to limit my salt intake to help control my blood pressure. C, I can continue to drink alcohol as long as I keep it under 3 drinks per day. Or D, I should incorporate more fruits and vegetables in my diet. Pause to think about it. I'm about to reveal the answer. The answer is C, I can continue to drink alcohol as long as I keep it under 3 drinks per day. Did you think this one was on the easier side? Let's talk through it. What do we need to know in order to answer this question? We need to know about the pathophysiology of hypertension. And when it comes to potential lifestyle modifications, that would fall into step 4 of a silver bullet study system outline about hypertension. So if we know our normal foundational information about hypertension, if we know the pathophysiology behind hypertension, then we are always going to be able to predict the symptoms and complications of hypertension, which means we can also predict the nursing and medical care for hypertension. And that's what we're looking for in this question. We'll remind ourselves of what is being asked. We're looking for a statement that indicates a need for further teaching. We are looking for a false statement. Let's treat each one like true false. I should try to exercise at least 30 minutes most days of the week. That's good. Exercise helps hypertension. This is a true statement, therefore it's not the one we're looking for. B, I need to limit my salt intake to help control my blood pressure. If you understand how osmosis works, then you know this is also a true statement. Water follows salt, generally speaking. If we limit salt intake, then less water will be tempted to stay in the body, and that will help decrease blood pressure. C, I can continue to drink alcohol as long as I keep it under 3 drinks per day. This may confuse you if you're still not feeling confident with your thinking like a nurse ability, because they add that caveat of keep it under 3 drinks per day, and you might think, well, that's in moderation. However, alcohol is a risk factor for hypertension, so any alcohol in somebody who already has hypertension is going to make this a false statement. We'll check the last answer choice just to be sure. I should incorporate more fruits and vegetables in my diet. That is always a good thing. That statement does not indicate a need for further teaching. Question 4. A client with newly diagnosed hypertension is started on a thiazide diuretic. Which statement by the client indicates a correct understanding of the medication? I should take this medication right before bedtime. I need to increase my intake of potassium-rich foods. I will limit my fluid intake to prevent excessive urination, or I can stop taking the medication once my blood pressure normalizes. Pause to think about it. I'm about to reveal the answer. B, I need to increase my intake of potassium-rich foods. Let's think through this like an experienced nurse. What do we need to know in order to answer this question? We need to know what the mechanism of action for thiazide diuretic is. Isn't that nice of them to actually give us the drug class this time? It also helps to know a little about the pathophysiology of hypertension, but that's honestly not required in this question. Then we remind ourselves of what the question is asking. We are looking for a correct statement by the client. A, I should take this medication right before bedtime. This is not correct because a thiazide diuretic works on the kidney and the main therapeutic effect is to release more water. Therefore, if we take the medication immediately before bedtime, we're going to be up all night peeing. Don't take a diuretic before bed. B, I need to increase my intake of potassium-rich foods. When you dig into the mechanism of action for a thiazide diuretic, you discover that, like our aldosterone hormone in question number 1, thiazide diuretics mess with the balance of sodium and potassium being released with the kidneys. And in this case, thiazide diuretics are getting rid of potassium. Therefore, clients on thiazide diuretics are at risk for hypokalemia, which is why it's a great idea to increase your intake of potassium-rich foods to counteract that. C, I will limit my fluid intake to prevent excessive urination. While some clients might have a diagnosis where they need to limit their fluid intake, it is not because they need to prevent excessive urination. In fact, the thiazide diuretic is going to be causing some excessive urination. That is the therapeutic effect. D, I can stop taking the medication once my blood pressure normalizes. This is a misunderstanding because the medication is not curing their hypertension, it is managing their hypertension. When you study your drug classes with the Silver Bullet study system, I always recommend taking a moment in step 4 to identify whether the medication is fixing the problem or managing the symptoms of the problem. And in most cases of hypertension, we are managing the problem. Question number 5. A client is admitted with a hypertensive crisis. The healthcare provider prescribes intravenous nitroprusside. What is the primary nursing consideration when administering this medication? A, monitor for signs of hypoglycemia. B, ensure the client remains NPO, nothing by mouth. C, protect the medication from light exposure. Or D, administer the medication via intramuscular injection. Pause if you need to think about it. I'm about to reveal the answer. The answer is C, protect the medication from light exposure. This is an interesting question. Let me talk you through it. What do we need to know in order to answer this question? It's helpful, again, to know what drug class is nitroprusside in. Another benefit of having studied with the Silver Bullet study system that I teach is what I call the ripple effect. Because even if you never specifically studied nitroprusside, having studied other blood pressure medications will help your critical thinking skills so you can think through this question, make a really good educated guess, and have a good chance of getting it correct anyway. For example, if we know they're in a hypertensive crisis, we can make a very good educated guess that this is probably a vasodilator or an antihypertensive. So we can assume that's the drug class. And if you've studied ACE inhibitors or beta blockers, then you've studied antihypertensives and vasodilators. If you've ever studied myocardial infarction, you know that nitroglycerin is a common medication given for angina. And when you see nitro, you might recognize some similarities in the name. And in fact, nitroglycerin is also a vasodilator. So don't freak out and go blank if you ever see a medication that you don't know what it is. Take what you do know and then practice thinking through it the way that you do in your study time with the Silver Bullet study system. That's how you get comfortably passing grades in nursing school and feel confident like a nurse. Let's look through the answer choices. A, monitor for signs of hypoglycemia. Hypoglycemia is low blood sugar. I don't see any direct connection between a vasodilator, antihypertensive, and blood sugar. So we can eliminate A. B, ensure the client remains NPO, nothing by mouth. Nursing students without a clear way to think through this question might be tempted by this because it is a hypertensive crisis, and we often want clients to stay NPO when they're in crisis. But why is that? A lot of times it's because we're preparing them for surgery, and we don't know if they're going to need surgery, but if they are going to need surgery, we don't want anything in their stomach. And that is not the case in a hypertensive crisis. Surgery is not going to fix this problem, so we can eliminate B. C, protect the medication from light exposure. If you have not specifically studied this medication, you may not know if this is right or wrong, but there's no reason to cross it out just because we're not sure. So even for that reason alone, when I answer a question like this, I would keep it until I'm finished looking at all the the answer options. D, administer the medication via intramuscular injection. Obviously, this one is incorrect because the question identifies that the prescription is for intravenous nitroprusside. So if we administered it via intramuscular injection, we would not be following the prescription and our nursing license would be in trouble. We can easily throw out D. Now, if the question had not included intravenous, then this would be a little trickier because then you would have to know what's the appropriate method of administration for nitroprusside. But they told us, so that's nice. Now, because we've eliminated A, B, and D, that makes C the answer, even if we never studied that. And we can feel confident in that. Let me teach you a little bit about this so that it sticks in your brain and you never forget. Nitroprusside is a medication that when exposed to light, it breaks down. The molecules in the medication just break apart from the energy in the light wave. That's like physics stuff, but you don't have to study physics. It's okay. Because it's also chemistry, but you don't have to remember much about chemistry either. Just remember that when molecules change, their properties change too. And one property that can change is color. When nitroprusside is exposed too much to light and the medication inside begins to break down and change to other molecules, it will change colors from orange to brown to blue. If it is blue and you administer, you are giving your patient cyanide. Yes, the poison cyanide. Whoops. Tell me in the comments, what score did you get? And if you want to be able to think through NCLEX questions as easily and confidently as I just did, there's something you need to see. In the next video, I'm going to show you the exact study system I use to train nursing students to think like a nurse, not just to cram like a student. Because once you learn to study the right way, everything from hypertension to the very trickiest NCLEX style question gets way easier. Click over here to watch the next video, and I will see you there.